Hi everyone, so in this video I am going to talk about metabolic acidosis. As I mentioned in my previous video, metabolic acidosis can be detected by doing an ABG. So in the ABG, both the pH and the bicarb will be decreased. Okay, so here comes the causes of metabolic acidosis. What can be the reasons? So the first one is diabetes mellitus or diabetic ketoacidosis. So what happens in diabetes? So there is insufficient supply of insulin, so that causes increased fat metabolism. Okay, so when there is increased fat metabolism, there is excess accumulation of ketones and other acids. Okay, so when there is increased acids and ketones, it eventually causes acidosis. Okay, and the next one is excessive ingestion of acetyl salicylic acid. It is also called aspirin. The name itself mentioned that it's an acid, so there is increased amount of acids in the blood. Next one is high fat diet. So as I mentioned earlier, high fat diet, when there is increased fat metabolism, there is accumulation of all these waste products like ketones and other acids. Okay, next one is insufficient metabolism of carbohydrates. Okay, when there is patient who has some disorders that can cause insufficient metabolism of carbohydrates, there is not enough oxygen supply. The oxygen supply is not sufficient for the metabolism of carbohydrates. Okay, so the end product is lactic acid. Okay, when there is not efficient metabolism of carbohydrates, there can be increased amount of lactic acid in the blood, so that results in lactic acidosis. Okay, this lactic acid, when the tissues are deprived of oxygen, there can be increased amount of lactic acid when there is not enough oxygen supply. So especially when there is low blood pressure, there is not enough blood circulation to the other parts of the body, so the tissues are depriving of oxygen. That can increase the amount of lactic acid. Next one is malnutrition. So when there is malnutrition, there are not enough nutrients. Okay, and also there is the metabolism. It doesn't happen properly. Okay, so it causes the fat catabolism, leading to excess buildup of ketones and acids. Like I said before, when there is too much fat metabolism, it can lead to the production of acids and ketones. And the next one is renal insufficiency, like when there is acute kidney injury or chronic kidney diseases. There is increased waste products of protein metabolism when the kidneys are not able to excrete all the waste products. Okay, so there is increase in acids. So when there is kidney problems, we can expect metabolic acidosis. Okay, and the last one is severe diarrhea. So when there is diarrhea, you see the intestinal and pancreatic the secretions are normally alkaline. Okay, so when there is too much diarrhea, all these alkalines we are losing, so there is excessive acidosis. Okay, we lose alkalinity of the intestinal secretions. Okay, when there is diarrhea, so that causes increase in acidosis. Okay, and the next one is the clinical manifestations. Okay, so the clinical manifestation, it is same as the respiratory acidosis. So if you can look at here, the neurological signs are drowsiness, confusion, headache and coma. It's same as respiratory acidosis. And when it comes to cardiovascular, there is decreased blood pressure and dysarrhythmias. And as I said earlier, in acidosis, there is increased potassium. So the dysarrhythmias are due to hyperkalemia, and there is also warm flush skin. And then when it comes to gastrointestinal, there is nausea, vomiting, diarrhea, and abdominal pain. And the respiratory manifestations are deep, rapid respiration. Okay, the deep rapid respirations are it's a compensatory action by the lungs. Okay, it is also called Kusumal's respiration. Okay, the Kusumal respiration is rapid deep respirations. Okay, so the interventions, treat the underlying cause. If the patient is here with the diabetes and that leads to acidosis, then treat with insulin and fluids, and treat kidney disease also. Start dialysis and nutritional management. See, when we talk about the causes, we saw a lot of stuff about the metabolism of carbohydrates, fats, proteins, and also always provide low protein and high calorie diet. Okay, and then there is a quiz. The nurse is caring for a patient with a DKA and documents that the patient is experiencing Kusumal's respiration. Which pattern did the nurse observe? So, the option A, respirations that cease for several seconds. Option B, respirations that are regular but abnormally slow. Respirations that are labored and increased in depth and rate. The last one, respirations that are abnormally deep, regular, and increased in rate. So in my last PowerPoint, the last point was deep and rapid respiration. It is also called Kusumal's respiration. So the option D is the right answer. All right, thank you for watching.